We watched Little Miss Sunshine and decided to analyze Frank.
Frank Ginsberg was a professor at a university who fell in love with one of his students, lost the love of his life and a prestigious award to his nemesis, and got fired from his job at the university. Frank is also the uncle of Oliver Hoover and the brother of Cheryl Hoover in the film, Little Miss Sunshine. When he joins the family, they are about to embark on a trip from Albuquerque to California, all powered in one van to allow the youngest, Olive, to fulfill her dream of being in a beauty pageant. The doctors recommend that for Frank's safety he is not to be left alone or anywhere near sharp objects. Therefore, he must tag along on their trip to the West Coast.
We diagnosed Frank with major depressive disorder, which is a mood disorder in which feelings of sadness, loss, anger, or frustration interfere with daily life for weeks or longer. While grief is a normal way to cope with loss, it should not carry on for an extended amount of time, and in Frank's case, should not lead to suicidal thoughts and actions. To be diagnosed with this disorder, one must have 5 or more of the following symptoms present for 2 or more weeks. Depressed mood, diminished interest in most activities, increase or decrease of appetite, increase or decrease in sleep, feelings of restlessness, fatigue or loss of energy, feelings of worthlessness or excessive guilt, diminished ability to think or concentrate, recurrent thoughts of death or suicide. The relevant DSM-5 category is 296.22.
To be diagnosed with MDD, there can be specific instances that trigger this emotion. The triggers in Frank's life were first the man that he was in love with fell in love with someone Frank despised, then the termination of his employment, and finally disappointment and failure in his field of study. While these developments in Frank's life warrant some degree of sadness, it should be short-lived. In Frank's case, however, his immense sadness about the recent developments in his life led to him attempting to commit suicide. In the movie, he exhibited a depressed mood from the time Cheryl came to pick him up at the hospital to the end of the movie, when his spirits were lifted after spending a crazy couple of days with the Hoover family.
Throughout the movie, Frank displays no signs of increased or decreased sleeping or eating habits. He is seen sleeping at night and also shown sitting at the table with the family enjoying fried chicken. He also ordered a blue raspberry Slurpee from a convenience store when the family stopped to fill up the van with gas.
We recommend that for Frank to treat his MDD, he should be a part of a supportive home life so that he does not feel worthless. Those around him will show him love and support. He should also seek medical attention so he can receive a prescription for an antidepressant that can be used in conjunction with seeing a therapist, because this has been proven to increase the happiness in MDD patients. If that combination is not successful, then Frank's doctors would suggest the use of electroconvulsive therapy.
What is electroconvulsive therapy? We will play a video explaining what ETC is and why people have the stigma around this type of treatment.
Electroconvulsive therapy, or ECT, is often called a treatment of last resort for patients who haven't had success with drug therapies, who have life-threatening psychiatric conditions, or who are suffering a catatonic state. ECT induces a brief seizure in a patient which resets the brain functions associated with some psychiatric disorders.
It's typically indicated for treatment-resistant psychiatric conditions, most commonly mood disorders or depression, but there are multiple types of depression, so it can also be used to treat bipolar depression.
The majority of ECT treatments are managed like outpatient procedures, and the patient is given general anesthesia.
When the patient's asleep, the stimulus is delivered, the seizure is monitored, they'll have just one seizure.
An electrical current is given to the brain, low enough not to harm the patient, but high enough to trigger a seizure. The treatment team can even touch the patient.
Some ethical concerns about ETC are those that prefer a mind, body, spirit, emotion approach instead of the use of traditional medicine.
These forms of treatment are accepted and proven ways to decrease major depressive disorder and allow the victim to lead a more normal life. Typically, people diagnosed with MDD use a combination of both therapy and antidepressants to decrease their amount of negative symptoms and increase their happiness.
This movie did a fairly good job of portraying depression. At the beginning of the movie, Frank is shown in the hospital in a wheelchair, staring out of the window. This displays his lack of energy and will to enjoy life. When his sister comes into the room to take him home, he avoids conversation and eye contact. Once back at Cheryl's house, he doesn't engage in much conversation. Throughout the movie, he has his wrist wrapped at all times, and while the movie never shows that he is taking medication, he must have, because he begins the movie quiet and reserved and ends it in a much happier mood. This could also be attributed to the loving and supportive family that he is welcomed into. Regardless of how crazy they appear, their love and support is evident in the way they support Olive in her pageant. This crazy loving lifestyle allows Frank to feel welcomed and keeps his mind off his recent hardships.
Not everyone is personally exposed to mental disorders, which is why it is very important that films accurately portray the different types of disorders. Due to some exaggerating scenes on the big screens, people tend to create a stigma over these disorders. Whether it's good or bad, no one truly knows how that individual feels.
This is the end of our case presentation. We hope you enjoyed our slides and think that our clinical diagnosis is relevant to our character, Frank, from Little Miss Sunshine.